Like I said before, I want to give thanks to all the workers here, whatever kind of work you do. Special thanks to the mothers and the fathers here in the United States who are the unpaid labor force, raises our next generation. Real special thanks to the birth workers, to the midwives, the doulas, the nurses, the doctors, lactation consultants, childbirth educators, placenta processors, anyone who dedicates themselves to thinking and working with pregnant women and you moms and families. Good morning, Amelia. Good morning. My name is Laura Marina Perez. I'm a home birth midwife. I'm going to speak a little bit to that perspective, from that perspective. As much as I'm going to speak somewhat about home birth, I want everyone to know I really support women birthing wherever they choose to birth their babies. I support Improving Birth's message that all women deserve informed choice in their pregnancy, labor, birth, and postpartum. So I was asked to speak a little bit about health disparities in the United States regarding people who are not white. And I love talking about this stuff. I think it's really important. So I want to talk about some good things first, some not so good things, maybe some bad things, and the beautiful things at the end. So the good things, there's good news for proponents of home birth like myself. The rates of home birth are on the rise. There was a study that came out a few years ago that stated that home births in the United States increased by 29% from 2004 to 2009. That means there were about 29,700 births in the United States that happened. That's amazing. That's the highest number since we started collecting this data in the late 80s. That's really great news. The CDC, the Center for Disease Control, also says, quote unquote, that home births have a lower risk profile than hospital births. So I kind of interpret that as meaning that home births are proven safer than hospital births. So again, the CDC states that the percentage of home births that occurred that were preterm, meaning a baby was born at home before 37 weeks, was half of that then for hospital births. So that's 6% versus 12%. 6% at home versus 12% in the hospital. Also, the percentage of home births, according to the CDC, that were happened for babies that were low birth weight, under 5 pounds, 8 ounces. Again, half of that at home than it is for the hospitals, 4% compared to 8%. The other really good news that we know is that for women that have had a cesarean section and want a vaginal birth afterwards, most women are actual candidates. They can actually have a vaginal birth after cesarean section. And most women that attempt to have vaginal births are successful after their cesarean. Yeah! That's really, really great news. That's awesome. So specifically, what does all that mean for women who are African American, Latina, Asian Pacific Islander, or Native American? Well, while these home birth statistics say that home birth is on the increase in the United States, in the reality what that means is 1 out of every 90 white women is having a birth at their home or birth center. That's awesome. But what that also means is that the percentage of home births for white women is 3 to 5 times higher than that for any other ethnicity. So that means, conversely of course, that fewer black women, Latinas, Asian Pacific Islander women, Native American women are having their births at home. And why is that, and what does that mean? So I'm concerned about this when I think about the benefits of birthing at home, like the CDC states, greater chance of not having your baby before it's actually due, less chance of having a preterm baby. And when you birth at home, there's a less chance of having a low birth weight baby, and low birth weight babies have greater struggles generally than babies who are above 5 pounds and 8 ounces, right? What we also know, kind of going back to the good news, is that women who birth at home or have midwives as their primary care providers have a higher rate of initiated breastfeeding and sustained breastfeeding. That's significant. We know, generally speaking, babies who are breastfed are less risk for a lot of problems and complications and diseases. Less risk of diabetes, less risk of obesity, less risk of a lot of other issues. So, what we also know, unfortunately, is women of color have lower rates of initiated breastfeeding and sustained breastfeeding than white mamas. So then those babies aren't getting those benefits. That's very concerning. And just to go back to the VBACs for a second, I talked about how most women are candidates for VBAC, and most women who try to have a vaginal birth after a cesarean are successful. Unfortunately, women who want to have a VBAC, most of the time that doesn't happen. There's a 92 repeat cesarean section rate in the United States. That's outrageous. That's outrageous. It's not okay. And that's why we're here to say enough is enough. That's not okay. That's not evidence-based medicine. So did everyone know that September is Infant Mortality Awareness Month? It's very important to think about that. What is the infant mortality rate? Well, we know in the United States, it's not that great compared to other countries. Given the amount of money and technology and providers we have here, it's kind of ludicrous how high both the infant mortality rate is and the maternal mortality rate is in the United States. I'm going to read a little bit from the Infant Mortality Awareness Campaign. They state that infant mortality and low birth weight remain major public health issues in the United States. And although infant mortality has decreased in the last decade, more good news, the gap between whites and people of color has not been closed. Infant mortality among African American women is more than twice that of white women. And low birth weight among African American women is more than twice that of white women. And for Latinas and Native Americans, the infant mortality rate and low birth weight rates are significantly higher than that for the white population. So what this all means is that families of color need special attention, need special focus and priority in their perinatal health services. Just last week, amazing group of women initiated Black Breastfeeding Awareness Week, or Black Breastfeeding Week. Really, really important. That's August 25th through August 31st. And unfortunately, some people got their panties in a bunch about that and felt that that wasn't okay somehow, or that why are we separating out African American women for a breastfeeding week? And there's already a breastfeeding awareness week and month, and shouldn't that include everybody? Well, that would be nice. That would be very nice if it did, but it doesn't. We know that the benefits of breastfeeding include reducing the risk of a mama having breast cancer in the future. Breastfeeding reduces the risk of uterine cancer in the future and reduces the risk of ovarian cancer in the future for the mama that breastfeeds for, I believe it's 6 months or longer. Remember what I said before? Who are the communities that don't do that as much? And surprisingly, maybe not surprisingly, who are the communities that have higher risks of breast cancer, higher risks of uterine cancer and cervical cancer? Cervical cancer isn't related to breastfeeding, but I had to throw that in there. It's Black women, it's Latinas. So there have to be specific programs that we developed that are created specifically for these communities to encourage them to breastfeed, encourage them to not have interventions in their birth so they're less at risk for breastfeeding complications, less at risk for cesarean. I'm going to talk a little bit more. So there was a study done throughout the 90s and all the early 2000s in Southern California looking at women who birthed at Kaiser Permanente. It was about 541,000 women. And so a little bit more bad news. The C-section rate increased over that time, 61.6% for white women. That's a huge increase. But unfortunately, the C-section rate increased more for Black women, Latinas, and for Asian Pacific Islander women, like significantly much more. That's problematic. Okay, so enough of the bad news. I want to talk about what I think, actually, take that back. Why is this happening? So this is my perspective. There may be studies to back this up, but I'll tell you what I think. I think there's socioeconomic disparities that are a big part of why these things are happening. There's a lack of access to education, lack of access to quality, culturally appropriate health care for women of color. There is a current war on the poor. There's a war on women. There's a war on poor women, women of color in the United States. That needs to stop. So what the beautiful good news is that I believe that big change is possible. What we're doing here, is part of this big, big change. This is part of the birth revolution. I believe we are changing things for the better. I believe that women and mothers can and will rise up and say enough is enough for all of us, regardless of what our skin color looks like. We need to be treated with respect and with dignity when we're pregnant, when we're giving birth, and postpartum. So I encourage us all to support policies and practices that put mothers and women's voices and needs and decisions first. All women. And this means African American women, Latino women, Asian Pacific Islander women, Native American women. Our voices, our needs, and our decisions have to come first around our bodies, our babies. I encourage all of us to do what we can to see that every woman has culturally competent care. That means that we need more birth workers who are from Native American communities. We need more African American doulas. We need to support midwifery programs that are graduating more Latina midwives. We need more lactation consultants from the Asian and Pacific Islander communities. I'm going to end with a quote from Helene Gayle. And if you don't know who Helene Gayle is, you should get to know her. She is the president and the chief executive officer of CARE United States of America, which is one of the leading humanitarian aid organizations that's fighting global poverty. Helene Gayle says you can't marginalize more than half of the globe's population, meaning women, and more specifically women of color, and expect to see any meaningful solutions to the problems that ail the world. So I'm really glad that we're doing this here today, because we will not be marginalized. We will create meaningful solutions to the problems within our maternity system. Thank you for listening. La lucha continua, the struggle continues.